Borrelia is one of the spirochetes. Now, this spirochetes is different from the other because it is irregularly loose and it can take up giemsa stain and silver stain, and can be seen not under dark microscopy, but it can also be seen under light microscopy. But the other thing is that it can be grown in bacteriological medium, but the thing is that by doing routine blood culture and spinal fluid, we don't get any result. It is actually negative. But if we culture the tick vector, it becomes positive. So even though it is grown, but it cannot be seen in blood nor the spinal fluid, but it can be seen in the culture of tick vector. So even though it's grown, but it still gives us the same result that it is not grown on the bacteriological medium. But the thing is that it still can be grown in the vector. So in this broad classification, Borrelia, we have basically three organisms. Borrelia Burgdorferi, which causes Lyme disease, and Borrelia recrutans, and Borrelia hermesii, which causes relapsing fever. Now, the special thing about this organism is that it can be supplied from a vector to the human body by a specific arthropod. Now, the specific arthropod in Borrelia burgdorferi is tick, which is the specific type of tick is Isodex capillaris or Isodex pacificus, whereas the relapsing fever is caused by a human body louse. Now, this infection by recrutus or B. hermes, what it helps in relapsing fever. Now, what is actually relapsing fever? Now, meaning that this organism, when the human body is infected, now what happens is that when this organism, this actually spirochete, what it continuously changes its antigen. So different types of antibodies are made after some time. While it's changing its antigen, the patient would have constitutional symptoms of the disease. So you can have a fever up to 3 to 10 times, and the disease would similarly go on. So hence the names given to this disease is that is caused by this organism is known as relapsing fever. That meaning that even that you're taking a lot of antibiotics, you still don't get well, and you still have a raised antibody titer, and you continue having a fever as many as 10 times. Now, this also consists upon constitutional symptoms such as prostration, headache, fever, which is the disease itself. This organism can be found on peripheral blood smear, and the treatment for such disease is actually giving the patient tetracyclines. Now, back to our initial organism which causes Lyme disease is Borrelia burgdorferi. Now, in this we know that it is caused by a tick. Now, the tick that is carrying this organism is Isodex capillaris. Approximately 30 to 50% times the infection is because of this tick. Now, this tick is mostly present in the US across the west coast, whereas the other tick, which is known as Isodex pacificus, is present across the east coast, and this is approximately present on the west coast, and it is 2% of the times it is present here. So meaning that east coast is more prevalent to this Lyme disease than the west coast. Now, the tick has a specific stage of life in which it is more infective. Now, we know a tick has various stages of life, which consist upon being a larva, a nymphal stage, and an adult. So the most infective of all of these stages is actually the nymphal stage. Now, as it is transmitted to humans, this disease has a high incidence in the months of May and September, which is mostly across the summers, and this tick must feed for at least 24 to 48 hours before becoming infectious. So it needs a specific incubation time in the organism itself in order to be infectious. Then after it bites the human, it directly disseminates into the whole body. As it has two two different types of hosts, such as the tick and the human. So it adapts to their bodies by producing specific type of surface proteins, which is known as outer surface proteins. Hence, there is a great genetic variation or antigenetic. There is actually antigenetically varies in their proteins when they affect the humans, as well as when they affect the ticks. So whenever we are doing culture for a human person, it comes out negative, but if we're doing for a tick, it comes out positive, because the antigens are quite different between these two. The feature has 3 stages. Now, in the first stage, what happens is that on the surface of the skin where the organism or the vector has bitten, we have a bullseye or target-like erythematous lesion known as erythema chronicum migrans, which appears on the skin approximately 33 to 30 days after the bite. This is actually painless, non-pruritic, and it has no specific symptoms in this body, such as arthralgia, because Lyme disease especially causes arthralgias and body pains. In stage 2, what happens is from the skin it gets into the disseminated phase. Now what happens is that it can disseminate up to weeks and to months, and it can affect various organs such as the heart, causing myocarditis. And if we see this on ECG, we'll see a prolonged PR interval, which will indicate first degree type of heart block. Then the brain, it causes aseptic meningitis. It can also cause cranial neuropathies. But the specific feature of this is that it causes bilateral facial nerve paralysis, that your nasolabial fluid will be lost, there will be drooping of eyelids, there will be loss of facial sensation, there will be loss of taste sensation on the face. So this actually causes specific disease known as Bell palsy. Then after such all of these diseases, it enters a latent phase in which there is no specific infectious state, and this latent phase can be up to weeks or up to even months. Then after some time, what happens is that stage 3 develops, which is actually a late disseminated stage in which this organism goes to the joints, causing arthritis-like symptoms. Now it affects mostly the weight-bearing joints or the large joints, which is the knee joint, and it can also cause encephalopathy. Now, laboratories. We know that culture does not give us the organism, so cultures are rarely positive. So what do we do instead? We do a serology, we do ELISA. In ELISA we can detect the titer, which consists upon IgM or IgG antibodies, and usually the antibody titer increases after 2 to 3 weeks. So we cannot delay our diagnosis. So what we do in order to get an early diagnosis, we do a PCR to detect the DNA of the organism or the spirochete within the body. But in sometimes even PCR comes positive or false positive, because there are a lot of spirochetes as your normal flora of the body which is present on the mucous membranes. So what for specific diagnosis, that if the disease is present or not, we do a Western blot analysis test. Now this is the gold standard test for identifying this Borrelia Burgdorferi. Now, treatment is that, first of all, what do we do? Stage 1, we give the patient doxycycline or amoxicillin, and whereas in stage 2 and 3, we give the patient ceftriaxone.